where do you compress? Wherever, very close to the heart. Where is the heart? More towards the left side. Is it in the midline? Not in the midline. Slightly to the left, where my hand is. Where my left hand is. That is my heart. This hand is the midline. This depression that we see in the middle is the midline. To the left, we have to do it. Now, here you can do a chest compression depending upon the person whom you are trying to do. I'll give you a situation. No offense to the gender here or anything, but please remember this. Practical experience. Elderly Americans follow different method. Europeans follow different method. They have a conflict. Americans say this. If you see this bony curvature here, this bone here, and then it comes up and it ends in the midline, in the center here, isn't it? They use that land, not Americans. Europeans use this as a landmark. Whereas Americans say nipple line. Nipple line. Suppose if I have an elderly lady or somebody who has got a liver cell failure and he or she has got a big breast and it is hanging, where will I go for a nipple line? It won't be here, it will be somewhere here, it happens. You will have to be mindful of that. So I prefer, personally, even though it takes extra 2 seconds or 3 seconds, I prefer the European style. This is how it goes. So if I am to the right side of the victim, I take 2 fingers, I'm a right-handed, it can be a left hand as well, choice is yours. But remember, heart is to the left of the chest, not in the center, slightly to the left, large portion is to the left. So how do we do it? 2 fingers. Can you see this curvature on this particular region here? From there, you run your fingers till you reach the center. So this is what we do. Run your fingers till you reach the center. This finger remains here for a while. This left hand now comes into the picture now. This part of my left hand, heel of my left hand, is placed above but slightly to the left. Just slightly, few centimeters to the left. Again, it is above but slightly to the left. Once this is done, this hand has no work now. It has to help this hand. Clasp the other hand, lean forward, there you go. Again, European way, 2 fingers, left hand or right hand. You can run it along the bone. That you can run it from that side or this side as well. Idea is bring it to the center. Once you have reached the center, take the other hand which was free, place it above but left of the victim, not the left of yours. No, victim's left, slightly to the left. The other hand. Once this hand is on the chest, this hand is free. Clasp your hand,
start pressing,
lean forward. But there are 2 things that is good for you which you have to follow, which is once this hand is here, you have clasped, do not bend your elbow, lock your elbow, lean forwards. Now already I am compressing the chest a little bit. All I need is a little bit of pressure for me to compress. I don't have to be muscular to do it. Technique. Never look up and do. You will have a neck pain, you will have a back pain. So you are putting your body weight on the chest of a person slightly, not too much, to compress. So for which what happens is here there are something. Already patient is on a hard floor. That is vital for the chest compression. So European way, 2 fingers up to here. Other hand slightly above but little bit to the left. Release this hand, clasp the fingers, lock your elbow, lean forwards and start compressing. This is how it goes. 1 and a 2 and a 3 and a 4 and a 5 and a 6 and a 7 and a 8 and a 9 and a 10. 1 and a 2 and a 3 and a 4 and a 5 and a 6 and a 7 and a 8 and a 9 and a 10. 1 and a 2 and a 3 and a 4 and a 5 and a 6 and a 7 and a 8 and a 9 and a 10. 30. If you count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, it's too fast. It can't be fast, it can't be slow, it has got a speed. 1 and a 2 and a 3 and a 4 and a 5 and a 6 and a 7 and a 8 and a like that it has to go. It comes with practice. So there are some magic words that you need to remember. You don't have to memorize this. Just remember, you have to press hard, press fast. Why hard? For me to compress the chest of a person at least 2 to 2.5 inches down, only then I can squeeze the heart. If not, I cannot squeeze the heart because of my compression. You are working like the heart for the person whose heart is not functional. So this is vital and has to be done. Press hard, press fast. When you press hard, roughly 2 to 2.5 inches, it goes down. For that to happen, you need to be high above the victim. Putting a victim on a table and compressing, no work. It doesn't happen. Flow this high so that my body weight is lean on the victim, and then I start compressing. Never look up. Your neck will strain. Look down. Compress. 1 and a 2 and a 3 and a 4 and a 5 and a 6. When you do that, from the shoulder, the weight is transmitted. You're not bending your elbow. You're leaving your body through thrust on the chest of a person. It becomes easy. Sorry? And we will come back. We just finished the other. And the question is, what if it is a baby like that?
Yeah.
Can I put my body weight in this 90 kg?
No.
Can it go? It's gone. Come back to that. Right. Thank you. Are we okay?
Yes.
Press hard, press fast.
fast.
Second point. When I compress, I need to allow the chest to come back to its normal position before I go to the second compression. 1 and a 2 and a 3 and a 4 and a, that is what you need to remember. Give time for the chest to come back to its normal position. Press hard, press fast. Give adequate time for the chest to come back, which you call it as recoil of the chest when you compress. And if I continue to compress for 1 full minute, I will hit the number 100. So when you compress, the speed is at the rate of 100 compressions per minute. But we are not doing 100, it is 30. Press hard, press fast. Give adequate time for the chest to come back. Number 2. Number 3, it should be at the rate of 100 compressions per minute. Not 100, don't worry. Don't worry. Are you okay?
Yeah.
Right? This is chest compression. The next thing is option.